This is gonna be a longer video, but I truly wanna share with you my journey to clear skin from having hormonal acne in my teenagers years, in my adult years, even when I was pregnant, and even post-pregnancy. I wanna share with you exactly what I did. If you've been following me for a while, you know that I have hormonal acne, and this is something that all my patients know, and I'm very true and honest about it because why hiding that? And of course, when you have hormonal acne, that means that your testosterone levels are elevated and you need to lower your testosterone level, and that's gonna help you produce less sebum. If you produce less sebum, then the environment or the perfect house for acne bacteria is not going to wake up. Again, it's not a cure. Hormonal acne does not have a cure, but you can easily control it. So this is my skin now. I do have makeup, but as you can see, I still struggle with some acne. But again, it's much better, and I'm gonna post pictures so you can see how I used to look and how I look now. But I promise you, it's worth it to listen to this video because I'm gonna give you some tricks that you can start implementing from day one to help you with clear skin. First, you need to have good gut health. Meaning, if your intestines, if your stomach, if your colon are not having a good time, that's gonna be shown on your face. Example, my triggers are chocolate, sugar, and carbohydrate. So I know if I eat that or I drink something high in sugar, I'm gonna wake up with a pimple. I know that's a trigger for me. Also, if I stop taking spironolactone, which is the medication that I take to help me control my testosterone levels, I'm gonna be paying for it. And I know I don't like to be depending on a medication, but it's truly what had helped me. I even did Accutane many years ago, and I did it twice. And if you have acne, you know exactly what Accutane is and how bad it is for your body. It didn't help me. So I take spironolactone every single day. I build myself to 100 milligrams, but I always start patients in 25 milligrams, 15 milligrams, and then we go up as needed. I don't start anybody on spironolactone unless I have a comprehensive medical history and I have some fresh blood work. Again, spironolactone is a medication that is used off-label for hormonal acne. It is actually a heart medication. Now I take spironolactone. That's something that I put myself on to help me control my testosterone level because I knew from day one I had hormonal acne. After I grew up and I wasn't a teenager anymore and I wasn't a young adult anymore, I'm in my 30s. I knew I had hormonal acne, especially because the pimples and the cystic acne is localized on the lower part of your face. I have a very strict skincare routine. Throughout the years, I've been playing around with different products, over-the-counter, prescription, and medical grade. But the routine that I found work on me is utilizing an exfoliating cleanser. The one that I use is from CO Skin Health, salicylic acid, 2%. Now, you have to be mindful that dryness can occur if you don't properly moisturize afterwards. So I use exfoliating cleanser, salicylic acid. I use an antioxidant. I use a Daily Power Defense from CO Skin Health. You don't have to be on that medication or that skin care unless you want to, but it's full of antioxidant, and that's something that you need, and it's also going to provide hydration. I also use Hydrinity Restorative Hyaluronic Acid, which is to restore your skin and is safe for acne-prone patients. And I also use a sunscreen with niacinamide. So niacinamide is the antioxidant that you have to be using if you have hormonal acne or even aging. Vitamin C is not recommended for acne-prone patients, and this is something that dermatologists will talk to you about, and this is something that I learned throughout my career and throughout going to conferences. Vitamin C is not good for acne-prone skin, so don't use vitamin C. If you're looking for an antioxidant, use niacinamide instead. So I use Elta MD Tinted UV Clear Sunscreen, which is available on our website coming soon. But I just love it. I've been using this sunscreen for many years, and I have tried so many, but I also go back to the Elta MD sunscreen. At night, I use my cleanser, my salicylic acid, my Daily Power Defense, my restorative hyaluronic acid, and I use my Brata Life also from Hydunity. That's going to help me with any type of pigmentation or dark marks that I have on my face and sun damage. And then I use retinoid. So I was on prescription tretinoid, but the reality is that you cannot be all the time on prescription tretinoid because one, your skin is going to get used to it. Two, it can thin your skin. So I always tell patients we're gonna be alternating or cycling off prescription strength tretinoid. So I use a retinoid that is medical grade. It's not over the counter because over the counter products, even though they're good, they can only stay in the surface of your skin and they cannot go into the deeper layers of the skin. So someone that has, like, let's say cystic acne and acne scars, you need different type of medications in order to help you with your problem. So that's basically the skincare routine that I use. I exfoliate at least once a week. You cannot exfoliate every single day. Even though I use an exfoliating cleanser, it's mild enough to be using every single day, but you don't want to exfoliate too much because that can also aggravate your skin and make your skin break out. Facials are important to help you deep clean your face, your pores, and everything that's on your face. And I also do chemical peels. Chemical peels are amazing if you have acne. Now, not all chemical peels are done correctly, so we need to make sure that the chemical peel you're gonna get is appropriate for your skin type and your skin concerns. Microneedling is extremely important if you have acne scars. However, if you have active acne, you cannot microneedle because what you're going to do is you're going to break that active acne and you're just going to spread it around the rest of your face. So you cannot do that if you have active acne. No microneedling. If you don't have active acne, but you do have acne scar, then it is a game changer. I have a specific protocol that I put my acne patients on to help them to clear skin. Now, it's not easy and it's not gonna happen tomorrow. You've been struggling with this for years, so it is, we can't fix this in a month or two. It can take easily 6 months to a year and more for that journey to clear skin. I've been on this journey for more than 10 years and I still don't have clear skin, but I am happy where I am right now because I know my triggers. I know how to control that. Now, when someone has severe acne scars, then I like to bring my big guns. And my big guns are radio frequency microneedling, if not active breakouts, and CO2 laser. That's gonna help you tremendously with acne scars. I know I speak a lot, but feel free to reach out, to send me a message, to send me a DM if you want to learn more or if you have specific questions. Have a good rest of your day. Dr. Ayala signing. Also, I forgot to say you need to take probiotics and you need to start taking daily zinc as an antioxidant to help you with gut health.